My name is Dr. Colton Bartels. I'm one of the 3 doctors here at Advanced Sports and Family Chiropractic. Today what we're going to talk about is how to stay young for the first 100 years. Now, I know that sounds kind of funny. It's kind of that catchy title where you go, do I really need to know how to stay young for 100 years? Is it important information or is it not? And so that's kind of what we're going to cover today. As you can see up here, absolutely we do need to know how to stay young for that long. We're living longer. The average lifespan in the year 1900 was only 49 years. The average lifespan today is a little over 77 and a half years. So things have obviously gotten a lot better since 1900. We're living a lot longer. In the year 2006, the University of Texas did a study that said by the year 2050, there would be 800,000 Americans that would live up to and over 100 years of age, and many would be living to 150. So on the Today Show, when you're watching and they're showing the oldest people in the country as it flashes across the screen, instead of seeing 101, 102, 110, we're going to be seeing 145, 150. Pretty crazy stuff. So when you start to think about that, and think about how old, we plan on living or how long you want to live, you have to kind of start to prepare maybe for a little bit extra than what your parents or what your grandparents had. Now, obviously, in 1900, more people died when they were younger. There's been a lot of advancements in medical practices since the year 1900. We don't see as much, I don't know, did you play the Oregon Trail on the computer? The cholera, dysentery, all those things that people used to die from along the trail. We don't see that much of an issue with these days because of the advancements in medicine and in healthcare. But what we can look at is the chances of us living to be the age of 80 are pretty good. Long life's revealed a few things. We're seeing a lot of baby boomers getting older right now. Some diseases and things that maybe we didn't see as much of back in 1900 as we do now. Alzheimer's. It's not that Alzheimer's didn't exist. It's just that people weren't living long enough to notice the ramifications of that neurological degeneration. We've also seen a huge boom in cosmetic changes, cosmetic surgeries, ways to make ourselves look younger on the outside. But it's also revealed what neglect to our structural system has shown. Now remember, that average lifespan in 1900 was 49. The studies have shown now recently the most common cause of functional disability in people over the age of 50 are spinal disorders, those neuromuscular skeletal disorders, muscles, bones, joints, things, again, they weren't living that long in 1900 to notice how much degeneration, how much wear and tear their bodies were actually going through. If I could tell you that somebody was going to break into your house tonight at 7:30, they were going to take your TV, they were going to take your computer, and they were going to take your secret fireproof safe. If I could tell you all those things, when they were coming, what they were going to take, you'd do everything that you could possibly do to prevent it from happening. Well, I'm standing here telling you right now that if you plan on living past the age of 50, somebody's going to come in and is going to try to steal your ability to move, function, enjoy, have a good quality of life. If we lose our mobility at 65 and we live to 105, that's 40 years of immobility, of pain. It's not always the quantity, it's the quality. If we're going to be living longer, we want to be able to enjoy those years. So what's improved along with our extended life? We take better care of our teeth now than, say, George Washington did. We don't see a whole lot of wooden dentures now. We know that we need to maintain our tooth health. We have to brush, we have to floss, take care of those things, or else our teeth fall out. We don't wait till our teeth fall out now before we start to do something about it to prevent that. It's a fact. We kind of joke around about this here at the office, but if our spine was on our face, we'd take better care of it. If everybody could see what our spines look like, we'd definitely take better care of it. We want to make sure that we brush our teeth to make our teeth look good. We comb our hair sometimes. Try to present the best possible presentation forward to the world. If our spine was on our face, we'd definitely take better care of it too. We'd want to put that best projection forward. Like I said earlier, we don't wait till our teeth fall out before we decide to start maintaining them. We take a lot of preventative steps to keep that from happening. So why do we wait till our backs go out before we decide we want to take preventative steps, before we decide we want to do something about that? Take the gamble that you're going to live past 50 and take the steps now, both you, your family, to prevent those major changes in those spinal disorders. So we're going to go over why preventative care is so important. There's no such thing as a spinal transplant. We get one, and we get what we get, and there's no turning back. You can get a new set of teeth, you can get a new heart, new lungs. They have transplants for everything except for the spine. you're stuck with it. You get the one that you've got, and once it's worn out, it's worn out. It's not just limited to your back either. The World Health Organization did a study. 10,000 adults, random, 1 in every 3 suffered from neck pain at some point in their lives. Of course, we plan on using our neck after the age of 50. That same study, 85 in every 100 adults had experienced low back pain at some point in their lives. That's a pretty good percentage. I mean, when you're thinking 10,000 people were polled, 8,500 of those people had lower back pain at some point in their lives. You know, it's going to happen. It's there. We have to take care of ourselves. The problem is most of us wait till we're in pain before we decide we're going to do something about it. The key there is that preventative chiropractic care that I was talking about. About the age 30, we hit our top functioning capacity. We're functioning at the best we possibly can at about 30. Now remember, this is without taking any preventative steps, without exercising, without worrying about diet, without those preventative chiropractic visits. This is kind of the arc that we follow. And we get close to that, you know, average lifespan of about 80. As you can see, at 40, we're back down to about 75%. At 60, we're down to about 25%, and you know, the end of the road. But you know, it's kind of an eye-opener when you think about that. You know, we develop so fast, and you know, 0 to 30, and we're at 100%, and then this nice roller coaster down as we get, you know, live and move, get a little bit older. The question is, can it be changed? Is it ever too late? And the answer is it's never too late. Depending on where you're at on the scale and the amount of changes that your spine's taken, whether there's any arthritis or degeneration, we can prolong and oftentimes even improve that spinal health, your functional ability to, you know, 60, 70, 80, at that 80, 90%. Of course, this is an inevitability. We are eventually going to get older. Things do wear down. We won't prevent it, but you can prolong it and enjoy that high functioning for as long as you possibly can. We have this big warning up here. Pain is usually what brought you in here. Pain is going to be the first thing that goes away. What pain is just a symptom. Just because you don't have pain doesn't mean there aren't any issues going on. It's kind of that red flag, that check engine light that our body gives us to say, hey, something's not right. So the desire is going to be, after that pain goes away, everything's fine, I don't need anything, and that's not the case. So there's 3 phases of care: pain relief, stabilization, and maintenance, and we'll kind of go through them one by one. Pain relief is phase 1. It's what brought you in here. It's that back pain, this neck pain, shooting pains, numbness, tingling, all those kind of things. The cause and what we treat are called subluxations. Basically, areas of the spine where the vertebrae have moved out of alignment that cause inflammation, swelling around the nerves, can a lot of times put pressure on the nerves, pinch the nerves, cause muscle spasms, can cause shooting pain, numbness, tingling, all those things, depending on where and how much that pressure is being put on the nerve. So the solution to that pain is the adjustments. We want to remove the pressure from those nerves. We want to improve your functionality, your ability to move on your own. The adjustments gradually move the vertebrae back into alignment. Kind of like to compare it to braces. It doesn't all get better in one visit. You know, it's a gradual process. We have to change the soft tissue around it that supports it and holds it in place. But the important thing, don't stop here. Don't stop because you're out of pain. That's not the end of the road. We have to move on to stage 2, and that's the stabilization part. It's been a lot of times, by the time pain kicks in, your spine's been misaligned for a long time. So like I said, the soft tissue, the muscles that support everything, get kind of locked into that out of alignment place. And so when we adjust something back, it tends to drift back just a little bit. And that's why it's a series of adjustments to get it to line back up. And then we have to do those exercises to strengthen and stabilize the spine to hold everything in place. This is our quote-unquote braces. This is where we hold everything. We want to strengthen and stabilize it. We got to allow all that supporting musculature to hold, to tighten back up. Of course, it takes work. It takes time. You can't just go to the gym one day, lift a bunch of weight, and get huge. Unfortunately, I would love that. If it worked like that, I would be a lot bigger than I am. But it doesn't. It's a gradual process. We have to build that strength and stability back up. Stage 3 is our favorite stage. It's maintenance. As you reach that stabilized condition where you're not drifting back out of place and everything's holding where it's supposed to be, we back off. Everybody's maintenance is a little bit different. Personally, I'm about between every 2 weeks and once a month, depending on how hard I am on myself. Our bodies are like cars. The harder we are on them, the more maintenance they need. But this is kind of where we back off. This is where we want all of our patients. We love seeing you in here, but we don't want to have to see you any more than we absolutely have to.